Every NASA astronaut undergoes the most rigorous medical evaluations on Earth before stepping into space. Today, we'll break down the exact physiological screening, training protocols, and how the human body adapts and suffers in microgravity. Pre-flight medical screening. Medical selection standards. NASA's initial astronaut selection requires candidates to meet strict medical criteria. Vision must be correctable to 20/20 in each eye. Blood pressure cannot exceed 140/90 millimeters of mercury. Candidates must pass a Class 3 FAA medical certification, equivalent to commercial pilot standards. Comprehensive testing protocol. Selected candidates undergo 4 to 5 days of intensive medical evaluation at NASA's Johnson Space Center. Testing includes cardiovascular assessment, stress testing, echocardiography, and coronary calcium scoring via CT scan to detect arterial disease, pulmonary function tests, spirometry and diffusion capacity measurement to ensure adequate oxygen exchange, laboratory work, 40-plus blood tests measuring hemoglobin, cholesterol, glucose metabolism, kidney function, and hormone levels, neurological evaluation, MRI imaging of the brain and spinal cord to rule out structural abnormalities, orthopedic examination, bone density scans, DEXA, spinal imaging, and joint assessment for osteoporosis risk, vestibular testing, caloric tests and rotational chair assessments measuring inner ear function, critical for space motion sickness susceptibility, psychological evaluation, comprehensive psychiatric assessment over multiple sessions, evaluating stress tolerance and cognitive function, ongoing annual monitoring after selection. Astronauts receive annual medical exams every 12 months. If they're assigned to a mission, evaluations intensify to every 6 months during the 18 to 24-month training window. Final pre-launch medical clearance occurs 45 days before launch. Physical conditioning protocol. Baseline fitness requirements. Astronauts must complete 1.5-mile run in under 12 minutes, 40-plus consecutive push-ups, 45-plus consecutive sit-ups, VO2, max minimum of 45 milliliters per kilogram per minute, integrated training program. Training spans 18 to 24 months with structured phases. Phase 1, general preparation, months 1 to 6, 90 minutes daily. High-intensity interval training, HIIT, running, cycling, and rowing, for cardiovascular endurance circuit training, combining weightlifting and gymnastics, core stabilization exercises, up to 3 times per week. Phase 2, microgravity adaptation, month 7 to 18. Neutral buoyancy laboratory, NBL. Underwater training, the world's largest swimming pool with full-scale ISS mock-up 7+ hours per spacewalk simulation, requiring 6 hours underwater preparation per 1-hour spacewalk. Resistance training shifting focus from gravity-dependent to stabilization exercises. Treadmill running with harness systems simulating reduced gravity environments. Phase 3, mission-specific conditioning, months 19 to 24. Sport-specific training, rowing gymnastics, for proprioceptive training, maximum strength training. 3 times per week, powerlifting sessions targeting functional movement, core endurance, planks, dead bugs, and anti-rotation exercises. Flexibility training maintaining 90+ degree range of motion in major joints. Musculoskeletal focus research shows astronauts lose 1 to 2% muscle mass per month in microgravity. Pre-flight training emphasizes slow, controlled movements building muscle endurance rather than pure strength. Training targets: spinal stabilizers preventing microgravity-induced spinal extension, hip and shoulder stabilizers for microgravity mobility. Grip strength, minimum 40 kilograms, for equipment operation. Nutritional program, pre-mission dietary protocol. NASA establishes personalized nutrition plans based on individual metabolic rate assessment, micronutrient deficiency screening, exercise-induced metabolic demands, macronutrient distribution, protein, 1.6 to 2.0 grams per kilogram body weight daily, higher than sedentary population. Carbohydrates, 6 to 8 grams per kilogram for glycogen repletion post-training. Fat, 20 to 25% of total calories, emphasizing omega-3 fatty acids, fish oil, flaxseed. Critical micronutrients calcium and vitamin D, 1,200 milligrams calcium, 4,000 IU vitamin D daily, to combat bone loss. Iron, 8 to 18 milligrams daily. Pre-mission iron stores deplete faster in microgravity. Antioxidants, enhanced intake of vitamins C, E, and selenium. Microgravity increases oxidative stress. Sodium restriction, limited to less than 2,300 milligrams daily. Fluid redistribution in space requires sodium balance. Timeline, specific adjustments, 30 days pre-launch. Increased carbohydrate loading, 8 to 10 grams per kilogram. To maximize muscle glycogen, 14 days pre-launch. Increased sodium intake, up to 3,000 milligrams. To maintain blood volume in transition to microgravity, 48 hours pre-launch. Reduced fiber intake, to prevent gastrointestinal issues during ascent. From rigorous medical screenings detecting hidden cardiovascular risks, to 18 months of intensive physical conditioning and precisely calibrated nutrition, NASA leaves nothing to chance in preparing astronauts for space. These protocols are built on one critical reality. The human body experiences extraordinary stress in microgravity. Every aspect of pre-flight preparation exists to establish a physiological baseline strong enough to endure what's coming. But what exactly happens when astronauts reach orbit? How does the human body respond to weightlessness? If you want to understand what spaceflight actually does to the human body, Part 2 is essential viewing. Subscribe now so you don't miss it.